Celiac disease is a chronic autoimmune disorder triggered by the ingestion of gluten, a protein found in wheat, barley, and rye. In individuals with celiac disease, gluten consumption causes damage to the small intestine's lining, specifically the villi, which impairs nutrient absorption. Celiac symptoms vary widely and can affect multiple systems of the body. Common symptoms: digestive symptoms, abdominal pain, bloating, diarrhea or constipation, nausea and vomiting. Non-digestive symptoms: fatigue, anemia, iron deficiency, joint and muscle pain, skin rash, dermatitis herpetiformis, headaches or migraines, depression or anxiety, tingling or numbness in hands and feet. In children, delayed growth and development, irritability, poor appetite.
Patients often describe their condition as debilitating, with a mix of physical and emotional challenges. Severe discomfort from digestive symptoms, constant fatigue due to poor nutrient absorption, anxiety about food choices and potential contamination, frustration from delayed diagnosis or being misunderstood.
Celiac disease can be identified through the following methods. Blood tests: TTG-IgA test measures antibodies related to gluten exposure. EMA test confirms immune response. Endoscopy: a biopsy of the small intestine checks for villi damage. Genetic testing: identify HLA-DQ2 and HLA-DQ8 genes associated with celiac. Genetics play a significant role in celiac disease. It has a genetic predisposition, but not everyone with the genes develops it. Environmental factors like infections or stress can act as triggers, activating the condition. When someone with celiac disease ingests gluten, it triggers an autoimmune reaction. This reaction leads to inflammation and, eventually, the destruction of the villi in the small intestine. Let's talk about safe foods for those with celiac disease. Naturally gluten-free grains include rice, quinoa, corn, millet, sorghum, and buckwheat. Fresh fruits and vegetables are also safe. Meat, fish, and poultry, as long as they're unprocessed, are good choices. Dairy products can be consumed if there's no lactose intolerance. Legumes and nuts are also safe options. Now, onto foods to avoid. Gluten-containing grains such as wheat, barley, rye, triticale, and spelt should be avoided. Processed foods can be tricky as they often contain hidden gluten, like in soups, sauces, and dressings. Bread, pasta, cakes, cookies, and cereals made from gluten-containing grains should also be off the menu. Gluten-free flours are made from rice, almond, coconut, corn, chickpeas, buckwheat, sorghum, tapioca, and teff. These flours are combined to mimic the texture and flavor of wheat-based products. The cornerstone of celiac management is strict adherence to a gluten-free diet. Joining support groups can help with emotional challenges. Regular follow-ups with a gastroenterologist and nutritionist are important. Iron, calcium, vitamin D, and B12 may be needed to address deficiencies. Reading labels and avoiding cross-contamination when preparing food is essential for mindful eating. Visual elements to include: 1. A diagram of the intestine showing villi damage in a celiac intestine. 2. A symptoms chart split into digestive and non-digestive categories. 3. A safe versus unsafe foods table illustrating gluten-free grains and processed foods to avoid. 4. A life cycle of disease visual showing genetic predisposition, triggers, and the autoimmune response. 5. An example of a balanced gluten-free meal on a healthy plate. Celiac disease is a lifelong condition requiring vigilance, but can be managed effectively with the right knowledge and habits. By following a gluten-free diet and seeking support, patients can lead healthy, fulfilling lives. This script is structured for professional presentations, educational purposes, or patient counseling. Let me know if you need visuals created for this explanation.